Okay, guys, here we are. Welcome to the Fertility Solved Power to Create question and answer session number 1. And we are just going to wait a few minutes until some of these folks are ready to jump on in, and then we'll start taking some questions. We will probably start maybe just a minute or two after 8 o'clock for all of y'all. And you can feel free to share your cameras with me. I'd love to see you, but if you don't want to, that's totally fine too. You can just look at me the whole time. I don't know why you'd want to do that, but hey, good to see you guys. So I'm going to ask you two to unmute for a sec. Jonathan and Christy. Can y'all unmute yourselves?
Hi.
Hi, awesome.
Hi.
I am so excited to have you guys
Can you
here
hear
in
us?
particular. I can hear you. Yeah, can you hear me?
Uh-huh.
Awesome. I'm so excited to have you guys here in particular because y'all have gone through the course already, and we had our first coaching session today with Christy, and Jonathan. I got lots of info about you as well. So, Christy, were you able to open up that document that I sent you with the thing?
No, we just tried on his laptop.
No problem. So I'll resend it from my Gmail, and I
Okay.
won't encrypt it this time so that you guys should be able to open it up. But
Okay.
yeah, what I was really struck by in that coaching session was how many different levels there are that we can kind of really dive into deeply. And I honestly, even though we spent, a good half hour on it, I really feel like that was just the surface. When you go and actually do the tests and do the charting, I've got my dog here who is squeaking in the background. Hold on.
I thought it was a baby. I was like, do you have Sammy?
No, Sammy's but yeah, don't chew that. So
At least there's an explanation.
yes. So
she's just playing with a dog.
She is. She has this awesome donut toy that is like her favorite ever, and she likes to use it. She likes to bite on it. But yeah, like what I was saying was I was really really taken away. I mean, and I see this all the time in my office, so it really shouldn't be. Hey Natalie, how you doing? Hey Vicky, good to see you. Awesome. Thanks for showing up, guys. So excited. I was just Hi. I'm gonna mute all of you guys except Jonathan and Christy for a minute. So I was just talking to Jonathan and Christy for a minute today. Jonathan and Christy have actually already been through the Fertility Solved course. So they are, it was so awesome having our first coaching session today with them. And the first thing that I noticed, which was really, really cool, even more so than when I get to talk to people in my office, it was like she already had all of this information in her brain about what was normal, what was abnormal, the things that she was expecting were, a little bit off. And she was ready. Like, okay, I have noticed in my cycles that this part of my bleeding is different from what you were talking about. And I have a feeling that my thyroid is off and all of this stuff. So it was like the moment in my head because I was like, yes, oh my gosh, it's working. It's like
the course was really helpful in being able to refine down to kind of the asking specific questions because you knew a little bit of background and knew, it's the whole problem of not knowing what you don't know.
exactly
That was cleared up a little bit in that we had enough information to say, this is something that I have a question about, or this is something that we need to know more about.
yeah, it was just so much fun. And I feel like it was the most, like I've been doing coaching sessions since the beginning of the pandemic, right? All around the world, all sorts of different people. But this was undoubtedly the most productive coaching session in like half an hour. We packed so much into there, and I feel like we
I
didn't
heard.
we didn't just do a deep
I was
dive.
trying to summarize for Jonathan. I'm like, I don't know. I
Yeah,
can't.
wait for
I'm
the
not sure
paper. Wait for
how
the
much
paper.
time.
Because I was amazed. Like, we didn't just do a deep dive on Christy, we did a deep dive on you, Jonathan. And it was like, oh my
I
goodness.
know.
Like, it was just so much fun. And I am so excited to like start getting the results back and for us to have our next coaching session and then to see like how you guys chart and what comes up in the charting. I think it's just going to be so awesome to watch the changes over time as you start, you know, the different supplements we were talking about and everything else. So
Mhm.
really, really cool. So,
Yes.
all right, let's jump in here. And what I'm going to do is, do you guys all know how to like raise your hand in the chat box? Is that something you see as possible down there? So if you have a particular question, um, where this is a question and answer session that let me tell you just a touch about myself, and then we'll just jump right in and I'll just start taking questions and we'll kind of go through them for the amount of time that we have. So my name is Dr. Monique Ribeiro. I am an OBGYN physician. I was traditionally trained and went through residency, was trained to do all of the stuff, treating people with contraceptives for everything, placing IUDs, referring for IVF. And I had a massive reversion in my faith. And then I determined that I really wanted to do something different. And honestly, even the entire time that I was going through residency, I never wanted to take contraceptives myself. I was always looking for another way. I was always a very holistic person, wanting to use like oil of oregano and silver and, you know, herbs and stuff like that rather than using medications every chance I could possibly get, always trying to find the organic route and the natural route in everything that I did. So the traditional GYN medicine really did not align with my belief structure. And it was unfortunately the only way that I learned to do things. But thanks be to God, I was introduced to NAPR technology. Somebody gave me a book about it. And as soon as I opened up those pages and I read about it, I knew that this was the way that I wanted to practice medicine. And I love NAPR technology. Basically, what it's based upon is charting your cycles, your bleeding patterns, your mucus patterns, and then looking at all of that information to really understand what is going on with your menstrual cycle and with your fertility. And the bleeding patterns, the mucus patterns, the length of cycle, the symptoms that you experience around that time, they all tell a story. Every little bit of it tells a story. And once you learn what you're supposed to be paying attention to, it just makes it so easy to identify these issues and to address them. And there are so many ways that you can address them naturally. And I was trained in NAPR technology several years ago, and I've been practicing as a NAPR doctor. I currently own my own practice, Natural Women's Health. So if any of you guys want to check it out, you can go to naturalwomenshealth.com. And there you can access the Fertility Solved course as well. There's a page there that links right into the course. So I decided, you know, when the pandemic hit, I was already, you know, seeing patients in my office, offering them fertility services, offering them just normal GYN services and NAPR technology. And what I realized was there are so many people all over the United States, all over the world, who have not got the message of NAPR technology. When they go and see their gynecologist, basically what they're getting is, oh, you have abnormal bleeding? Let me put you on a birth control pill and we'll take care of those symptoms. You have PMS? Okay, let me give you an antidepressant or a birth control pill. Oh, you have painful cycles? Let me give you a birth control pill, or I'll give you a really strong pain medication. Like, it's the only field in medicine where we give the exact same medication to every single patient, no matter what their issue is. And the ultimate goal is never to fix the underlying issue, but rather to shut down the cycle so that you hide the problem. And I hate that. I really, really, really hate that. So my goal as a NAPRO doc is always to search for the underlying issues and to address each and every one of those issues at the very root. And, you know, it's interesting because even with NAPRO technology, we do look for the underlying issues, but there is a deeper level that even we can go. And I wasn't taught all of that during my NAPRO training either. So NAPRO technology will train you to identify if you have lower levels of progesterone. And then they will say, okay, now you can use compounded progesterone, which is natural, and you can give it at the correct time, which is all fantastic. And it definitely works. But what if you could go a step deeper than that and try and figure out, why do you have low levels of progesterone? And where does that progesterone come from? It always comes from the egg. So now you're talking about egg health. And that was one thing that we didn't really address with NAPRO technology. And I'm assuming that over time, they'll probably start teaching about that as well. But there's only so much you can teach, you know, in a shorter period of time. And so looking at egg health, I have done a lot of research on my own, you know, just looking at different fields of alternative medicine and how they address egg health. You know, the Chinese herbalists address it in one way, the naturopaths address it in another way, the acupuncturists address it in another way. So I believe as long as you are accessing types of treatments which do not go against your faith in any way, then I am totally on board with accessing those things. There are a lot of people who are, you know, completely faith-based and practice acupuncture, ardent Catholics, ardent faithful Christians, and I don't think there's any harm in accessing those services as well. So that's kind of my goal in everything that I do, not just to treat it, but to really look for that root cause. And so with Fertility Solved, what I've done is I have broken it down to the most basic lessons that I could think of. And, you know, thinking about it now, I think that's where the coaching sessions come in, because even what is really basic for me, because I'm a physician and this is like my bread and butter, and I absolutely, like, I could talk about this. Gosh, guys, if we had 5 hours on this Zoom, I could keep going, you know? So I just love talking about this stuff. It just makes me so happy and I enjoy it so much. So I have to like really make sure that what I have given, and I'm hoping Christy also will give me a lot of feedback as to like if there were certain modules or lessons that were harder to understand or anything like that, so that they can kind of be amended over time. But that's where the coaching sessions come in, because that's where, now that you've got your baseline and you have an base understanding of what's going on, then we can bring all that stuff up and we can kind of move forward. So first of all, does anybody have any specific questions or anything? If anybody wants to raise a hand, even like you can just raise your hand or whatever, or unmute yourself. Natalie, do you have anything for me? Go for it.
I do. So is this kind of concerning the coaching session,
No,
or
you
just
can
kind of
ask
overall?
absolutely anything. Yeah.
Okay. Awesome. Because I love, like, it's just so interesting, everything you're sharing about the fertility subs. So I have a question. So I have my husband and I are currently trying to figure out, so we are going through secondary infertility, and we're really trying to, like, we've found out in our labs that our DHEA levels are really, really high. And so we're trying to, you know, just see, like, well, I guess my question is more, and because like everything else looks normal, everything else looks fine. My progesterone levels are fine.
Level?
I don't know the number, but my doctor said, my NAPRO said that they were normal.
Was it
like
30 or above?
I have to check
the
that.
range. Yeah. Sometimes the range will fall into normal. But anybody in my office, even though the range is wide, if you have a 30 or above, I will automatically treat you as if you are a mild PCOS patient. And often elevated DHEAs go hand in hand with elevated testosterone, because the testosterone kind of follows from the DHEA and the pathways, right? So if you have an elevated DHEA, I think of one of two things. either PCOS, or is there a possibility of any sort of like adrenal mass or adrenal tumor that may be boosting those levels? Typically, if that's what it is, you will have sky high DHEA levels. They aren't just like, a 300 or a 350. Like that's kind of the upper end of like the DHEA. It's above normal, but it's not like in the thousands. You know what I mean? So with mild PCOS, the first thing that I have people try and use on a daily basis is Sensitol. And Sensitol is a supplement that you can purchase. There's a company I really like for supplements. So as many supplements as possible, I try to have people get them from there. It is a little bit pricey, but I trust them because so many natural doctors are using them. And it's the one brand that when I have people use their supplements, they always say they have like a good result from it. So I don't feel like it's diluted or tainted or anything like that. So Sensitol is myo-inositol and D-chiro, and you can get myo-inositol and D-chiro elsewhere. But if you want to get it on this website, it's designsforhealth.com. And in order to purchase there, you have to have a provider code. So the provider code for me is just my name, all caps with no space in between. So just all caps, Monique Ribeiro. And so I would definitely say Sensitol or myo-inositol and D-chiro. And I would do with Sensitol, it's like 1 capsule twice a day.
Okay.
I believe it's either 1 capsule twice a day or 2 capsules twice a day. It's written on the bottle as far as the dosage. Then I would definitely say anybody who is trying to conceive should be using egg health supplements. So you would want to check your vitamin D level, because if you have low vitamin D, that will affect your ability to, strengthen your follicles. And then depending on what your vitamin D level is, you would dose your vitamin D. If your vitamin D is in the normal range, if it's like, 30 or above, then you can probably even do like the 800 IUs. But typically, even if you're on the lower end of the normal range, 2000 IUs wouldn't hurt you. If you're really low, then I would definitely do 5000 IUs of the vitamin D3. But I would check your level regardless, no matter what you're taking, probably in another 2 to 3 months, and then see where your level is. Because vitamin D is a fat soluble vitamin, and you don't want to like overdose on it either. Okay.
I love that.
Yeah. So then the other two are coenzyme Q10. And if you're getting it from Designs for Health, then that one is called CoQnol. And then the next one is fish oil. So that one is called Omega Avail Hypo. So those are kind of the baseline egg health supplements, but there's so much more, right? Like there is, oh my goodness, there's royal jelly. Royal jelly, there's not a ton of studies out there, but I keep coming across it, which really makes me, the more that I see, every time I see it, it's somebody having a really good response to it with egg health. So that's just another thing.
Interesting.
Yeah, royal jelly. It's made by the worker bees for the queen bee. And it
interesting.
Yeah. So I believe the dosage for the royal jelly is like 1,000. I can't remember if it's micrograms or milligrams, but it's 1,000. You want to get pure royal jelly if you're doing that one, and that's depending on what your labs show. So if your labs show that you have lower levels of estrogen at any point, then maca root is something you'd want to consider. So like so much of it depends on exactly your symptoms, your bleeding patterns, your length of cycle, and especially your pre and post peak labs. So because you're working with a NAPRO doc, I'm sure that she's having you do pre and post peak labs. Not all NAPRO docs do the pre and post peak labs the same way. I have always done my poor patients, I put them through a lot. They're people who are drawing their blood know them very well.
Because they're like, I'm here again. I'm here again.
Yes, exactly. So we do I'll have them, if they have really super long cycles, I'll have them identify that first day of peak type mucus and start their pre-peak labs on that day. If they have minimal peak type mucus, but they still believe that they're ovulating, then we could always use like a clear blue digital ovulation predictor kit to identify that initial rise in estrogen and start it there. And then you do like every other day 6 estradiol levels. And then once you see that solid smiley face or that sign of ovulation, that LH surge happening, then you switch and you do estradiol and progesterone for another 5 draws. And you can tell
Interesting.
so much from that, because you get in the pre-peak, you get to understand, is this a person that needs letrozole? I never use Clomid because Clomid
No.
will reduce your mucus. And then in the
Yes.
post peak, you have an understanding of, does this person have estrogen dominance, or are their estrogen levels low? Do they have low progesterone, or do they have normal progesterone, or do they have high progesterone? So it's really, oh my goodness, those labs tell you so much. And typically I would do, on day 3 of the cycle, I would do like a full panel with a really deep dive into the thyroid, like TSH, free T4, free T3, reverse T3, total T3, and thyroid antibodies, thyroid peroxidase, and thyroglobulin. And when you check all of those, because oftentimes if you just check a TSH, free T4, free T3, they could look completely normal and you could still feel like you have thyroid dysfunction. And so, in order to identify a possible thyroid system dysfunction, which you wouldn't see normally with that TSH, you've got to check that reverse T3 and the total T3 and do a
To
calculation.
make sure.
Yeah.
I've never had pre-peak test. It's always been post-peak
Really?
7. Yeah.
So peak plus 7 only
Really?
gives you 1 day. And that peak plus 7, like, you could very well have normal until peak plus 7, and then you could crash. And so if there's anybody that comes to me with any fertility concerns, I will always do all of it. If it's someone who comes to me with like a PMS concern and they're not trying to conceive, then I'll just do post peak. But even then, I will do
Interesting.
3, 5, 7, 9, and 11, because
Wow. Okay.
yeah. And
Good
then
to know.
after we know exactly what's going on and they're on the supplements that they should be on, then I'll do peak plus 7. Because I think a lot of NAPRO docs are afraid to ask their patients to do that many labs. But what I find is that patients are typically very willing to do it because they want to
Absolutely.
themselves, like
Absolutely.
getting stuck is a small price to actually know what's going on. And
Exactly.
I don't feel comfortable treating somebody, especially like, I mean, all of these things are still supplements, medications, or things that we're adding to our body. So I don't want to make a mistake on giving something to somebody for a duration that they don't need, or a dose that they don't need, or give them something totally that they don't need just because I'm guessing because I don't have all the information.
Right.
So
I love that. So would you say, like, because my DHEA levels are at 4, it's like 403,
okay.
and they've kind of been between 380 to 400 like the past 2 years, I would say. But it's just, recently that I'm seeing a NAPRO. And so if like my testosterone is normal, like how you said, if it's below 30 and everything looks normal, is there anything else you would do, like other than like a CT scan? Like, would you ever refer to an endocrinologist at that point? Or
I honestly don't think they would do anything about it because it's not in the thousands. But I would definitely do a deep dive. I would do like a cursory liver function test just to make sure that there's no like elevated liver enzymes. Your liver's not over functioning or under functioning or anything. I would also definitely do a deep dive into the thyroid because all of these things are so interconnected. And so I would, on day 3, I would do like a full, make sure that you've got the full panel, and that make sure that your DHEA, your testosterone, all of that was drawn on day 3 of the cycle, not just randomly.
Oh, it was not, it was on post peak 7.
Yeah, so I always do, I do FSH, LH, DHEA, testosterone, 17-hydroxyprogesterone, and I typically do all the thyroid stuff as well all on day 3. And then I go from there. Yeah.
Okay. Good to know.
Yeah.
Okay.
And then I also, like, in the same, like, that entire initial workup, I do all of those labs. I get a baseline ultrasound, but ultrasounds are also another really important thing for timing. You have to do your ultrasound on day 5 to 7 of the cycle, because you want your ovaries to be at their quietest and your lining to be at its thinnest, so that if it's greater than 7 millimeters in thickness, you know that there's a thickening of that lining and there's something going on. If there is even one ovarian cyst that's present on day 5 to 7, you know that you have ovulatory dysfunction, because that cyst from the last cycle has not completely resolved.
Interesting. Okay. And would you also say, like, doing an ultrasound during ovulation to make sure, like, the DHEA is not preventing ovulation is also good?
Follicular ultrasound series is a different question, right? So that is when you do your initial baseline, and then once you start to have that peak type mucus, you start doing sequential ultrasounds, and you're following a specific follicle for its growth. And then once it reaches the size that it should ovulate, you keep going to make sure that it was completely ruptured. And so there are NAPRO centers that do this follicular ultrasound series. So you kind of have to search them out. Like here in Philadelphia, we have one center which is pretty close to us, and then we have another one probably an hour and a half away from us. And it's challenging, because it's not like when I try and send people to a regular radiologist and I give them all the instructions, I'm like, okay, tell me, is there any fluid in the cul-de-sac? And what is the thickness of the lining? And what is the size of this follicle in 3 dimensions? And blah, 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 blah. They don't give you any of it. And so it's like you have to have somebody who knows what they're doing when they're actually reading it. So, all right.
Thank you. This is so helpful.
Good. I'm glad.
Thank you.
So it looks like Carrie has written a message in the chat as well. So she says, we have secondary infertility as well. Our daughter was born via C-section in 2016. Since 2018, we have had 6 losses. Oh my goodness. I am so sorry, love. 4 of which were missed miscarriages, and we have been unable to have these babies grow past 9 weeks. I was on progesterone for the last 2 and baby aspirin and additional vitamins from my naturopath from the latest loss. We have had genetic and karyotyping tests for both myself and my husband, and we are normal. My doctor is unclear on where to go from here. Okay. So I have so many patients who have this exact same story. And first of all, Carrie, I just want to say you're a mom to all of these children. And just because they were not given the opportunity to live their life out here does not mean that you're not going to meet them one day when you go to heaven. And I believe that each one of these babies are saints in heaven, according to my faith, and that they can pray for you. And personally, I'm Catholic. Whenever I go to Mass, my 2 babies that are in heaven, I've named them, and I ask them to come down during the consecration of the host and to be with me during that time. And I believe that that is a possibility, and that they love you, and that you will all be together again. So sorry for your loss. I'm happy for them that they actually are saints. So you've got, oh, I'm sorry I made you cry, but I make everyone cry. That's my specialty. But I truly, truly believe it. So much to the fact that on our fireplace, on our mantle for our 2 girls, so they're Isabella and Therese. And so we have, an ultrasound picture for each of them. We were blessed to have that early. And then we have notes from everybody, and that's with our family pictures. Those are there. And we know the dates that they became saints, that they went to heaven. So we actually celebrate those dates. So we have a party, and we have a cake, and we have a dinner. And on the cake, we write Happy Saints Day or Happy Feast Day for Saint Isabella and Saint Therese. And so I highly recommend, like, don't feel like you ever have to hide this. When people ask me, how many children do you have? I always say 5. And I say, I have 2 in heaven and 3 here. So, like, I don't care if it was just a positive pregnancy test and you never had even an HCG level drawn. Like, you know that you were pregnant, you know that you had a child, and you know that that child's life is important and that that child is a saint in heaven, and that one day you will meet again. And each and every one of those saints can intercede for you and pray for you. And okay, as far as recurrent miscarriage workup, I'm sure that they've done like the typical workup where they check for all of the coagulation issues like antithrombin 3, anticardiolipin antibodies, PT, PTT, all of those things. Factor 5 Leiden, MTHFR. And it looks like they put you on the baby aspirin to start off with, just in case there was something there that might have caused an issue. If you have any sort of MTHFR abnormality, there's basically two genes, a C1 and an A1. If you have two copies of the C1, it puts you at a higher risk for blood clotting. So I'm sure they checked all of that as well. If that was the case, then they would have checked homocysteine levels, the B12, folate, all of those things to make sure that all of those levels were normal. So I'm hoping that they did all of that for you. The next thing I would talk about is you got to make sure that you're charting your cycles for sure. And you want to really take a really, really close look at your bleeding patterns. So if you're somebody who has spotting before your periods or spotting after your periods, if you have pain with your periods, those all mean things. Like spotting before your period could mean endometriosis, spotting at the end of your period could mean lower levels of progesterone or chronic endometritis. Chronic endometritis is not the same as endometriosis. It is an inflammation or an infection inside the inner lining of the uterus, which makes it very difficult for babies to implant. In addition, you want to make sure that the inner lining of your uterus does not have polyps, because if you have polyps there, then that reduces your chance of pregnancy by about 30%. So the way that you check for polyps is to have an ultrasound done in the first few days, day 5 to 7 of your cycle, and make sure it's a transvaginal ultrasound so that you can see the thickness of the lining. If your thickness of the lining is over 7 millimeters at that time, then I would be very concerned about a possible polyp being there. And sometimes it's just a matter of removing that polyp. If you have chronic endometritis, you would definitely want to sample the inner lining of your uterus. And at this point, if you haven't had that done anyway, I would definitely do it. And when that sampling is done, you want to send it to the lab and ask them to check for plasma cells and for evidence of chronic endometritis. But also you want to have them take some of the sample and put it in a anaerobic and aerobic culture, and then have them process that culture to see if there's any specific bug that grows out from that. That way, if there is chronic endometritis evidence, then they'll know how to treat you based on that culture rather than having to give you, tons of antibiotics. Typically, if we don't know what the bug is, we'll treat with 3 different antibiotics for 2 weeks each. And sometimes that causes other issues as well. So those are really important things. I would also do like all this baseline lab stuff that I was talking to Natalie about. So on day 3 of the cycle, you definitely want to make sure that you've done a deep dive into the thyroid and checked all of those thyroid tests that we were talking about. You also want to check all the PCOS labs. So DHEA, testosterone, prolactin levels, 17-hydroxyprogesterone, FSH, LH. You want to make sure that you're using the egg health supplements. So all those 3 things that I talked about, the vitamin D, you want to make sure your vitamin D level is good. You want to use fish oil. You want to use coenzyme Q10. I would have no problems if you were my patient, if you wanted to try the royal jelly. Depending on what we see from your pre and post peak labs, then I would testosterone post peak. Okay. See, Natalie, that 29 is really darn close to 30. So I would say, I would say that you probably do. You are a mild PCOS patient. Okay. Then I'd look for like the other stuff, are your cycles over? Sorry, Carrie, hang on one sec. So are your cycles about that. Over, 30 days at any point? Do you have any signs of PCOS as far as like hair growth around your nipples, below your belly button, in between your thighs, any like hair thinning at all? All of that sort of stuff also kind of pushes me over. But also on your ultrasound, are the dimensions of your ovaries, are any of them over 3? So like a
Mhm.
completely normal ovary is usually like 2 point something by 1 point something by 2 point something. But when you start having dimensions that are over 3 centimeters, then it always piques my interest. Like, is there a possibility of mild PCOS here? Okay, back to
Okay,
you, Carrie.
thank you.
You're welcome. So Carrie, then egg health supplements. Oh my gosh, semen analysis for your hubby for sure. So yeah, semen analysis is, oh gosh, I love talking about this. This is so cool. We only have a few more minutes before Zoom is going to cut us off. I promise I will do another one like next week or something. But let me just get this out real quick. So semen analysis, when they're done, you have to do it in an ethical way. So with semen analysis, the way you get by doing it ethically is you can purchase a male factor pack off of Amazon, which is a condom that does not have any spermicide in it. Then you take a needle and you boil it in hot water and cool it down. So you sterilize it and then you prick the end of the condom. So now it is a perforated condom. So it is no longer preventing you from conceiving when you use it. So you use this condom this perforated condom when you're making love, collect the semen sample, and then you determine if you're going to take that sample to the infertility center or if you're going to do it at home. So there is gosh, what is the name of it? There is a company that I'll put the link in the chat. Or I can, if anybody wants the link, I can just send it to you. Christy, I sent it to you guys earlier today. But it's a really cool company that yeah, I'm just looking. It's called Natalist, Natalist. And you pay, currently they're having some discount as well. So you pay for this thing, they send it to you, and then you can just dump that semen into this thing, seal it up, and then they overnight it back to themselves. And then they run it and they give you the result the next week. Now, the thing with semen analysis is that, yeah, there you go. So the thing with semen analysis is that typically when they do the report, they are grading it and they'll tell you it's normal or abnormal based on this Kruger's criteria. The Kruger's criteria basically says that even very low levels, it considers them to be normal. So like they've decreased normals for morphology, for motility, for volume, everything. So you have to look at it again when you get it to make sure that you're actually in the right range. I just completed a mini course for how to superpower your sperm, and I'll be adding that to the Fertility Solved platform probably this week. And then I'll have that for sale as well. But that's a really good one because it tells you all the numbers so that you can actually compare, and it talks about all of the different supplements. There is another thing which is super, super cool. It's called the Underdog, and it is like it's like an ice pack, but it's like an ice pack wedge, because the thing is when you have the scrotum, if the males will notice that if they're really cold, the scrotum will pull up. If they're really hot, the scrotum will fall down. And so when you're sitting for long periods of time, when you're driving for long periods of time, you don't have that opportunity of that movement of the scrotum. So your scrotum's temperature will actually go up by a couple of degrees. And there have been studies which have shown that even a 2-degree rise in the scrotum can negatively impact the sperm. And so this ingenious company took something so simple as a little ice pack and they made it into a wedge, and they got a little cover that they put on top of it. And you can just stick this little wedge underneath your scrotum when you're sitting at your desk or sitting on the couch or driving in the car. And it's cool. So it cools down that scrotum area. It's not freezing. So it's not like uncomfortable. It's apparently comfortable. But that will prevent you from having the damage to the sperm because of the heat. And so I would highly recommend looking into that. It's called Underdog. And using that on a daily basis just to protect the quality of the sperm. And there are so many things, like there's another supplement which is called NAC, and I use NAC a lot for people with endometriosis. But there have been some really great studies that I've read recently saying NAC can be used in the same way for women that have recurrent miscarriage, and it's actually really improved their chances of miscarriage. with the progesterone, the one thing that I have noticed is oftentimes people are placed on progesterone, but they don't check the levels frequently enough to know if it's adequate. So in my office, I check those progesterone levels every 1 to 2 weeks, depending on where we are and what they look like. And we are very active in changing the doses, upping the dose. So we always start with like 400 milligrams of the prometrium nightly. And then very quickly, if it's not enough, we'll go to 400 orally, 200 vaginally, and then we'll go to shots. And oftentimes I have people doing shots and oral and vaginal, and it's all based on the numbers. And so when it comes to progesterone, you might be supplementing with progesterone, but it still might not be enough. The other thing to look at is when you're doing those pre and post peak labs, make sure you're looking at your estrogen. Because if your estrogen is low, you might need something like 4 to 6 milligrams of estrogen on a daily basis to get you back to normal estrogen levels. And it's only like the studies that have been done, I usually start people on like a 0.5 milligram of estrogen, and that's really not enough if you're trying to prevent recurrent miscarriage. And so the studies that were done, 2 didn't seem to make a difference. 4 to 6 did make a difference, and 6 definitely made a difference. So you want to ask your physician to consider looking at that, making sure that you've definitely done the in-depth pre and post peak labs for sure, and seeing if that would help. So you get your semen analysis at Pope Paul, they mail it to us, and then we manually and then we find a lab that will manually check seminal. Are you taking new patients currently? If I wanted a second opinion, helping with figuring out my high DHELA, adenomyosis, but thin lining. Okay, yeah, so absolutely. Yeah, I have a medical license for Pennsylvania. So I can absolutely, anybody who's in Pennsylvania, I can take you on as a patient. If your insurance company will allow, I can do telemed visits for you as well. But if you live outside of Pennsylvania, what I can offer you is obviously the Fertility Solved course that I offer to everybody in Pennsylvania as well, because I only get to spend like 20 to 30 minutes with you every time I meet you in the office. It makes it so much more productive if you actually know what is going on with you before you come in. So we're not like digging and trying to find all of these things out. You already know, what your bleeding pattern is, what your mucus cycle is, what your cycle length is, what your post peak phase is. And those are the things that we spend so much time just trying to figure it out. Like I'm going back in the calendar 5 months. I'm like, give me the first day of your period. Let's calculate it. That in and of itself takes 10 minutes, and you don't want to waste any time when you're in a 30-minute appointment, right? So if you come in and you've already got all that stuff set and you know what you're talking about because you've already done the course, then gosh, you're in a completely different level. And then we can like really dive deep and we can address like I can't tell you, my head is bursting with all of the information that I just want to like take it and put it in your skull so that you have this understanding of everything that I know, so that you will know what to do and how to respond, and like, oh my gosh, like this is the symptom she was talking about. But when you don't have enough time, then you can't, like you just can't give all of that. So that's what the course is all about. And absolutely happy to do the course, happy to do coaching sessions. We have lots of different packages for the coaching sessions. So like obviously the more you buy, the better deal you get, kind of thing. The course is called Fertility Solved. And it is, if you go to naturalwomenshealth.com, I have a tab on Natural Women's Health, like a whole page. And you just click on that page and it'll take you right to the course, and then you can look at it. But it is, it's so exciting. I'm so happy with the way that it's turned out. And like, as you can tell, I never shut up. So like, I love talking about this. I love hearing y'all's stories, and I can honestly say every single one of these NAPRO babies, they're like my babies. And when I go to daily mass, I am taking all of you and all of your intentions, I know how much it hurts to be walking this path. And you guys have my heart. And I know how important it is to pray for y'all and to ask God to intercede and to bring you, the strength and the peace and the calm, and to just fortify your relationships and to help y'all be in a really awesome place and to be open to his will. Like I always tell everybody, if you have the desire to have a child, then the only being that could have placed that there, oops, oh my goodness, I have somebody here in the waiting room. Hi, Varney. So sorry to keep you out. The only person who could, or the only individual who could have possibly put that desire for new life into your heart is God. That's it. The devil is not in the business of growing families. He is in the business of destroying families. And so if God placed that desire in your heart, then that means that he has every desire to fulfill that. And all it takes is opening every door and every window that is ethical and moral, and he will grow your family. And I can't ever guarantee it's going to be through your belly. I can't ever guarantee it's going to be your sperm, your egg. But we do everything possible to bring you that level of understanding where you know what's going on, and like if you want to continue that path or if you want to make a different turn on that path. And I don't feel like adoption or foster is a failure by any means. I think it's actually the pinnacle of pro-life success when it comes to fertility. I truly believe that, gosh, for a child to be adopted, that means that that child's birth mother made the loving choice of allowing that child to live. And then the adoptive parents made the beautiful choice to embrace that child and oftentimes embrace that birth mother as well and encompass her also into their family. So it's just the most beautiful thing. And it's absolutely like there are so many ways that God builds people's families, right? It's through adoption, through foster, through, allowing you to conceive through your own bodies. It might even be just being that individual in the community that every kid on the block realizes you're the person who listens the best and makes the best cookies. And so your table is the one that they spend the most amount of time at, sharing all of their joys and their sadness and everything else. And that might be your role as a parent, but that hole will be filled. I am certain of it. He does that. That's what he does. And he is way more creative than any of us could ever imagine. And he brings about such a peace and such a joy. And just cling to him and know that he's got this. He's got this every step of the way. He's got this. So yeah, I am overjoyed that you guys all showed up. I'm so happy I didn't have to be here by myself because I can talk to myself the whole time about fertility, but it's not as fun. And I really hope that everybody who sees this on the replay afterwards, I hope that you get as much out of it. And I will try and book more of these. I really do enjoy it, and I like having this small intimate group. It's really nice to be able to actually have conversations with you guys and to share. I have a feeling this is probably going to cut out any minute now because Zoom is not very allowing when we get over the time limit. Oh, there's my girl. Hi, sweet girl. So, guys, I just want to introduce you to Thea.
Oh,
Thea is a miracle baby. Chris, oh, yes, darling, you're a miracle baby too. My doggy's here crying. Thea, at 18 weeks, Thea's water broke. And Thea, the doctors all advised that Christy have an abortion and end Thea's life. And Christy was, by the grace of God, she was so strengthened with an amazing husband, with Jonathan. And as a couple, they were surrounded by people who loved them and advocated for them and, would find, the right caregivers that they needed in order to support Thea. And yeah, look at her. I mean, she is such an absolutely gorgeous brilliant little girl and such a miracle. So happy that she is here. So, does anybody have any other last minute questions that I can address? Barney, Carrie? Okay. All right, guys.
Monique,
Yeah.
what was the water recommendation? You said half your body weight in what measurement?
So half your body weight in milliliters. So drinking water is super, super important because we all tend to be dehydrated, especially with the heaters that are on in our house in the winter time. And it's not, water doesn't tend to be the thing that people drink most often. And if you drink anything with caffeine, you're already taking a diuretic and you're losing your water. So you should always drink half of your body weight in milliliters. And
Milliliters?
yes.
You mean ounces?
Ounces, milliliters. What does it come in the bottles?
Ounces.
Okay.
Got it. There
That's,
you go.
I was like, 2 cups? No. Okay, and then
Ounces,
just
sorry.
next time, will you go over natural remedies for PMS? I was so excited to
Oh,
learn.
sure
that
thing.
You don't
Yeah.
have to go through
So the
PMS.
the PMS is, it can be caused by lots of different things. It can be due to low progesterone. It can be due to high estrogen. It can be due to low estrogen. It can be if your beta endorphins are off. So the number one thing, Christy, you guys are already doing, and that's cutting sugar. So cutting sugar is absolutely huge. The next thing I would definitely say, we will find out so much when we do your post-peak labs, those estrogen and progesterone levels after ovulation. And when we see that, then we will have a definite plan. But the majority of people, PMS is related to the lower levels of progesterone. So when you give back the right amount of progesterone, then you feel completely different. It's like life changing. Jonathan will be like, I got my wife back.
Yeah. Thank you so much. Thank you
You're
for
welcome.
doing this.
Yeah, absolutely.
That is so
All right, guys. And I am going to wrap this up. I'm just so grateful for all of you. Thank you so much for showing up. And we will do this again. Feel free to, I'll see if I can like reshare this onto Facebook and stuff like that. So if you want to share it with anybody. But otherwise, I will try and put it into a YouTube post, and it'll be on my Dr. Monique Ribeiro on YouTube. So you can always share it from there. All right.
perfect. Thank you so much.
All right, guys. Take care. God bless. Have a great night.